a 67-year-old man with schizoaffective disorder who's admitted for acute urinary retention and agitation. He's placed on an LPS hold for grave disability. He is combative. You're asked to prescribe an antipsychotic for emergency agitation. A baseline EKG shows a QT interval of 490 milliseconds. Which of the following is the best choice? So I want you to think about your answer and commit to it in your mind. I'll give you 30 seconds. Your choices are haloperidol, quetiapine, ziprasidone, or aripiprazole. All right, so the answer is aripiprazole, and I'm going to tell you why. So a little bit of review, I won't torture you too much, but this is the ventricular action potential. And so the QT interval is essentially measuring from the beginning of the Q wave to the end of the T wave. And the initial depolarization happens with the influx of sodium channels in phase of sodium through the sodium channels in phase 0. I want you to just draw attention to your phase 3. This is where the potassium current kind of leads to repolarization. And these particular channels are where antipsychotics have their effect on the QT interval, leading to QT prolongation. So for most of the antipsychotics, it's a dose-dependent QTC prolongation. And of course, why we worry about that is that risk of torsades, especially if the R wave happens on the T wave during repolarization. And they all work by different mechanisms, but haloperidol is kind of the main example. It blocks that IKR channel that was in phase 3, leading to repolarization. And essentially, by blocking that channel, it prolongs the QTC interval, but on average by about 15 to 30 milliseconds. And it's more potent, that effect is more potent when given IV. That's why there is that black box warning with IV haloperidol. So interestingly, there is actually a risk calculator to help you quantify a patient's risk of having QT prolongation. This is called the Tisdale risk calculator. It's based on a couple of studies and came out in 2013. It looks at multiple factors like age, sex, and then whether they have electrolyte abnormalities or certain other concurrent conditions that predispose one to having QT prolongation. And it just quantifies your risk here. So the risk of QT prolongation kind of varies across different antipsychotics. I'm going to draw your attention to the kind of the worst ones that we might use are ziprasidone and quetiapine. And then olanzapine tends to be have less of an effect on the QT interval. This effect of haloperidol, I think, is not referring to the IV formulation. And of course, the numbers vary depending on the study, but it's just to know that there are some that are worse and some that are better. So interestingly, aripiprazole, which was not on that table, is a unique antipsychotic. In some preclinical data, it shows that it has less affinity than the other antipsychotics for that delayed rectifier potassium current that leads to repolarization and delaying the QT. And aripiprazole in studies has been associated with actually a mean decrease in the QT interval, not an increase. We're not sure whether it causes a decrease in the QT interval, but it is associated with less QT prolongation. So all of that to say, you can draw the conclusion that the risk of QT prolongation is lower with aripiprazole than compared to placebo. That said, all of these studies do not involve patients who actually have high risk of QT prolongation. So you should still be cautious and practice by getting an EKG before, especially if you're worried if your patient has a high risk for torsades based on that risk calculator we used earlier. So in summary, most antipsychotics cause a dose-dependent QTC prolongation, which of course increases your risk of torsades. You can use the Tisdale risk calculator for quantifying your patient's risk. And this is a quick flowchart, but if you need to prescribe an antipsychotic, you should quantify your patient's risk of QT prolongation. And if they're at high risk, check a baseline EKG and continue to monitor it as you prescribe the antipsychotic. And if you really need to give an antipsychotic, consider aripiprazole over the others. And this is all, I learned all of this thanks to my wonderful psychiatry intern who I rotated with, Preston Igwe, who taught me this. So we can learn a lot from our colleagues who rotate with us. Questions or thoughts? All right. Thanks everyone for coming.